This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
The Berman Method Podcast. We are rolling, baby. Focused on treating problems and not symptoms. Dr. Jake Berman here with my beautiful co-host,
Jenny Berman, physician assistant.
We are David going against Goliath, trying to help show you there is another way. You don't have to listen to what you've been told. You should question it. If it doesn't make sense, ask somebody else. Just because your primary care physician said to go do this doesn't mean that that's the best answer. Just because your physical therapist told you to go do that doesn't mean it's the best answer. Just because your orthopedic surgeon said it's time to cut your knee off doesn't mean it's the best answer.
Right. And we see this every day in both of our practices of physicians telling patients something and they try it and they try to live with it and go with the route that they're saying is the only option. And then they finally end up seeing us for something different because what they're doing isn't working.
Exactly. It's one of the most frustrating things that I deal with as a physical therapist is I'll be working with a customer, getting some really good results. And this just happened a couple of weeks ago. This is a regular occurrence where we're getting really good results, let's say with plantar fasciitis, because that's the popular thing right now. And for whatever reason, the customer has a follow-up appointment with the podiatrist and thinks that he still needs to go there because he's got an appointment with the doctor and you can't cancel an appointment with the doctor, goes to the doctor and tells him about the progress and tells him that he's still having symptoms. And the doctor says, stop doing physical therapy for the next 6 weeks. You've got to rest it. So the patient cancels his appointments with me and I'm going, Bob, what are you doing?
Right. We're making progress.
It's going in the right direction. Well, the doctor told me that I need to rest it. I'm like, what? He's an expert. I didn't tell him this because, of course, I have to play the political game. But we've got to remember, he's an expert in surgery.
Mm-hmm.
He's not an expert in avoiding surgery.
Right. In the rehabilitation part of it.
Just drives me nuts.
Right. Right. And we have a similar story where I was helping a patient with granuloma annulare, which is a skin rash that is what they consider autoimmune, no cure to it, but it does eventually go away on its own after sometimes years. And the dermatologist told the client that it could be years before she sees any improvement of this. So we start working together and we've actually worked together in the past. So she had come back to me for this granuloma annulare, knowing that we work with a lot of autoimmune disease. And sure enough, within 4 weeks of starting the program, the rash was significantly improved. By 6 weeks, it was gone. And she went back to the dermatologist and they said, oh, it's just coincidence. And I was like, but they told you it was going to take years for it to go away. We've been working well together on this, very diligent on improving the cause of autoimmune disease. So starting with the gut, with blood sugar, with mood stability, cortisol control. And in 6 weeks, it's gone. But it's just coincidence. I'm like, okay.
Absolutely bonkers. But if you understand why, it will make way more sense. You have to understand that your in-network providers, the doctors that you go to that take your insurance, they are Western medicine and thought. They are quote unquote sponsored by pharmaceutical companies. That show on Netflix, Pain Pill, that is a real thing. You got pharmaceutical reps visiting these doctors on a daily basis, trying to get the doctor to prescribe their drug. And here's a perfect example. This is black and white. This is factual. You can look it up yourself. Ozempic, right? Ozempic, semaglutide, the magical weight loss injection that is taking the nation by storm right now is officially the most popular pharmaceutical drug in America right now. And it is predicted that within months, by 2025, over a third of Americans will be on Ozempic.
That's crazy. That's absolutely crazy.
A third. There's 331 million Americans. That means 110 million Americans will be on Ozempic within months.
I believe it because they're popping up everywhere. You know, I'm a part of a mom's group on Facebook, and there's comments all the time about going to these online places or walk-in clinics to get semaglutide injections with no other medical history, no other dietary changes, making sure we're exercising. Like, you literally just walk in and get the injection and pay your bill and walk out. It's nuts to me. Like, what, you know, and I've said this before, we utilize Ozempic and semaglutide in our office for the right person with the right monitoring and the right dietary changes so that we can eventually get you off of the medicine and maintain the sustainable weight loss that you've had. But there's so many different side effects to Ozempic that if you're not using it appropriately, it's really actually detrimental to you. I mean, that's with any medicine, right?
Yeah, because it's a chemical. They make this stuff up in a lab. They're using chemistry to compose this thing and inject it into your body. This is not a naturally occurring molecule in the world. This isn't marijuana that just grows naturally out in the wilderness. This is a chemical that is made up in a freaking lab that's tested on rats before they tested it on humans. And who even knows how much they've tested it on humans?
That's what clients will ask me, what's the long term? And I'm like, we don't know. There hasn't been enough research to know. Metformin, we know, is very safe. People have used metformins for tons and tons of years and have had no issue, minimal issues. I shouldn't say no issues, minimal issues, minimal side effects, long-term, tolerable use with the right monitoring, again, because there are certain vitamins that can be depleted, which can affect our brain function. Like, we know these things as medical providers. We don't know all of that information yet about Ozempic and semaglutide or Wegovy, Zepbound, Mounjaro. They're all very similar.
It's all new and it's all the easy button. It's the take the easy pill, hit the easy button. I don't have to change my lifestyle at all. And the weight just starts falling off and it's magical. This is the first time in the history of weight loss that there is such a thing as an easy button. I don't have to do anything different except get this injection and I lose weight.
Right. Pay the money. Yep.
Like, this is nuts. This brings us to what we wanted to actually talk about today, which is continuing our series on why should you do business with us? Why should you not do business with us? Why should you shop around? How do you get the most information? One of the biggest things that you have to know before you do business with us, or anybody for that matter, is what is the risk? What is the potential downside? In the healthcare industry, we see it a ton, and downstairs with us is by the time people reach us, they've usually spent thousands and thousands of dollars and years of getting the wrong answer. Back pain, for example, knee pain, for example, rest, take it easy. You're getting older. Do these crappy cookie cutter exercises that you can get off of Google. Get on the assembly line at the Cookie Cutter RS. None of it works. So by the time they show up in my office, they're going, why should I trust you? Like, I've already done all this. How do I know that you're going to get it right? How come you are smarter than everybody else? And when we start getting it right, then it's always the opposite. It's like, why is nobody else doing this?
Right. Why do people not tell me these things? Yeah. And we see the same thing by the time clients, majority of our gut health clients, by the time they come into our office, they feel like they've tried everything. They've done all these different medications and probiotics and fiber supplements and just haven't seen any improvement, that there's hesitation to think we are going to be different and to invest in what we're doing. Will they actually see a difference? And the answer is 99.9% of the time, yes, it's very different once they do invest and get their head committed to what we have to recommend. We're currently working with someone right now who said it to us just a couple weeks ago. She goes, I feel like I've tried everything. I'm limiting my diet to only 5 things that I'm eating, and I'm still having problems. So now you're telling me to add different foods back in, but it didn't work in the past. How do I know it's going to work this time? And it's just a matter of putting all the right cards together on the table as opposed to just doing one thing at a time.
It's so true. So what is the risk? The risk is, if you want to come work with us, the risk to working with Jake or Jenny is that you're looking for a quick fix. You're looking for an easy button. You're looking for semaglutide or Ozempic. You're looking to not change anything in your lifestyle, and you just want to lose weight. You're looking to not change anything. You don't want to do your exercises, and you want your back pain or your knee pain to go away. That is the risk. This is not an easy pill. I'm not a magician. I'm not just going to put my hands on you and magically your knee pain goes away. I will help guide you down the right path. I will be Mr. Miyagi and you'll be Daniel-san.
Mm-hmm.
And I will show you the path to get there. And it'll be the quickest path, the most efficient path, because I've already done all the wrong paths. I've already done all the harder paths. I've got this thing dialed down to where it is freaking turnkey. You do this step, finish this step before you go to the next step. You can't go to the next step before we finish this step, or you're not going to get there the quickest way. Same thing with you upstairs.
Right. And definitely everything has to be personalized to the individual because not everybody reacts the exact same way. But we, again, have done this so many times that we know which direction to go when we get an adverse reaction to something. So we certainly know that progress is not always linear. We're going to have the ups and downs, but the risk in my world would be not trusting the process, not trusting your providers, meaning us, to walk you through this. And whenever you do have a step backwards, ask us, trust us to help get you back up to 2 levels higher than you just fell backwards 1 step. And it's definitely possible, but nobody goes through a program with consistently linear progress. We're going to have steps backwards. You have to trust and take the risk.
I'm so happy you said that, because I've gotten to a point to where I actually script that out with my providers. Is when you get somebody that comes into our world that has had really debilitating pain for years, and they're going to come in within the first 5 sessions. It's usually around session 3 for whatever reason, but it's between 3, 4, or 5 sessions, 3, 4, or 5. They're going to come in on a high that you have not seen them on before. They're going to come in, let's say knee pain, and say, oh my God, my knee has felt amazing. It has not felt this good in years. And the thing that I've got scripted into my procedures is you have to humble that feeling. I'll say, okay, I'm super happy that you feel great. You got to remember that you've had knee pain for 8 years now. So what I don't want you to do is I don't want you to leave here today and go run a marathon or go walk around Costco for 5 hours or go play pickleball, because you're going to have a big crash after that. We've got to make sure that we follow the process, because you're going to have ups and downs. And sure enough, a couple of sessions later, they'll come in not depressed, but just lower and say, it's back. The pain's back. It's just as bad as it ever was. There's no difference at all. And I have to say those words. Mm-hmm. This is like the stock market. There's going to be ups and there's going to be downs. As long as we trend in the right direction, it is the safest place to put your money over the long term with the minimum amount of effort.
Right. And just being able to communicate with the provider about it, because we can typically pick out what caused the trigger. I know in my world, I can typically pick it out where the client never saw something that they ate as a trigger, or the stress that they had, or poor sleep for a couple of days triggering their GI issue. So I can typically put my hands on one or two or three variables that happened that triggered this backward step. And that's how we know which direction to go and how to fix it. Same thing with you. Usually you're able to pick out something that they did that they didn't even realize was going to be a problem, and then you're able to fix the problem again. But you have to be open with your providers. You have to talk to them. You have to communicate and trust again that we can figure this out and help get you to that next step again.
That's so true. What I found is 8 out of 10 times when people come in flared up after being flared down for a while, it's because something happened after they left our office last session. 2 out of 10 times it's because I just dug in too deep and we bruised the area and it's sore and it's going to take 48 hours to flare back down again. 8 out of 10 times something happened in between our last session and this session that they didn't even realize was significant. And that usually comes out somewhere around 47 to 49 minutes into the hour session.
Right.
And I'll be like, you did what?
Mm-hmm.
You walked up 10 flights of stairs and you have not walked up 2 flights of stairs in 10 years? And you just forgot to tell me that that's what you did right after you left here last session?
Right. Right.
Well, it felt good when I was doing it. I'm sure it did.
Right.
That doesn't mean that you're ready to do it.
And that's the same thing with gut issues and autoimmune issues, is it's usually 48, 72 hours before you're noticing significant impacts of it. And by then the client forgot what they did the 3 days prior, and they're trying to relate it to something they did that day where they were perfect. And they're like, this just doesn't make sense. This shouldn't have bothered me. But then we're able to typically, like I said, dig a little deeper and figure it out.
Exactly. So coming back to the original question, what's the risk? And when I first opened up my PT practice, this was very challenging for me to sell cash-based services in a predominantly insurance-based world. And it was really hard for me to communicate the value because I was so focused on the intervention itself, manual therapy. I'm going to make your pain go away. Nobody cares about manual therapy. Nobody cares about pain going away. What they care about is getting the result that they really, really struggle asking for, which is, are you going to get me to a point to where I'm anti-fragile? Are you going to help me maintain my independence? Are you going to help me get down on the ground and play with my grandkids so that I don't feel old? And once I was able to do that, or able to communicate that, then it was really easy to make the transaction. They're like, okay, I'm going to help you play with your grandkids. Sure. I swipe the credit card. Let's do this. The problem is it's not guaranteed. There's nobody on this planet that can snap their fingers and say, I guarantee your back pain is going to go away with this intervention. There's not a single person that can ethically make that promise to you. So it really comes down to trust. Do you trust Jake to do the right thing? Do you trust Jenny to do the right thing? And that's why we continue to try to spread as much information as we possibly can on when we do screw up, we're the first to admit it. We're not going to sit here and try to string it out and keep trying to take money from somebody knowing that we're not helping you. If we're not getting the results that we're looking for, it's quick. Within 2 to 3 sessions at the most, if I'm not getting the results I'm looking for, we're making dramatic changes, or I'm going to say, okay, we've got to get more information. Let's go back and get an x-ray or an MRI. Go back to the orthopedic surgeon and say, what do you think about this? Maybe we should consider an injection. So we're not going to sit here and string it along. We're going to continue problem solving this thing. Jenny said it multiple times. We never stop thinking about you guys. It's a 24/7 thing. So we're constantly trying to problem solve the most difficult cases that we have on the schedule.
Right, for sure. And, your world a couple visits, you can usually tell something. For us, it may take a little bit longer than that, but that's why we see our clients on a weekly basis, is so we can make the modifications and adjustments. That's why we have a texting system, so we can help throughout the week. So having that communication, like I said, is just the key factor to seeing this progress. And you mentioned the risk. What is the risk here? The risk is not trusting the process and trusting your providers, and the compliance, not listening to what the providers are recommending. You have to have your head in the game to be able to see the progress and the improvement. So if your head's not in the game, you're not ready yet. You need to have the head in the game. You need to trust your providers. You need to be ready to make the adjustments that we're recommending.
One of the simplest ways that you can do that is think about, if you've had knee pain for 10 years, what's a realistic time frame that you should expect it to be gone? It's not going to be 1 hour.
Right.
It's not going to be 1 day. It's not going to be 1 week. It's not even going to be 1 month. If you've been in pain for 10 years, that means that you've altered the way that you walked on that knee. So just because the pain goes away doesn't mean that the problem that caused the pain has gone away. So usually we can get the pain to go away within 4 to 6 weeks. But then we're going to take another 4 to 6 weeks to fix the reason why the pain was there to begin with. And then if you want it done the right way, it'll be another 4 to 6 weeks on top of it to make sure that the pain never comes back again. Because 10 years is a long time. Think about gut health. How long have people had gut health issues?
You're exactly right. And again, it's not predictable. Just like you can't predict when and how somebody is going to get better with their back pain. Is it going to be in 6 weeks? Is it going to be in 6 months? We can't predict that with gut health, or really with weight loss either. But we do know that the trust and the compliance does make the process more efficient, and definitely happens quicker with the trust and the compliance. But even more than that, we also have to think about our gut like a sprained ankle. And that's what I talk with clients all about all the time. Just because you can't see the swelling in the gut, the swelling and the inflammation of the gut takes just as long to come down as spraining your ankle and being in a boot for 6 weeks and allowing the inflammation to come down.
Love it. Absolutely love it. So in summary, the biggest risk to doing business with Jake or Jenny is expecting a quick fix. Expecting this to be easy. It will not be easy because we're going to do it the right way. Neither one of us half-ass anything. If you know either one of us, especially Jenny, she does not half-ass anything. If we're going to do this, we're going to do it the right way, and your life is going to be so much better once we do it. There's not a single person that you or I have worked with over the years that committed to the program and did all their homework who had buyer's remorse, because the easiest way to look at it is, as function goes up, pain goes down.
Right.
Meaning that if we focus on getting you stronger, more mobile, more agile, more efficient with getting around, your pain will go down. I mean, think about it. The biggest cause of non-traumatic pain is weakness.
Mm-hmm.
You can't do it anymore.
Right.
The biggest cause of gut inflammation is not knowing what the hell is causing it to begin with.
Right.
Once you know what's causing it, it's so much easier to not cause it.
Correct. And how to treat it the right way. People think, oh, it's easy to eat gluten-free, but it's really not initially easy because it sneaks in everywhere. But when you have the right provider helping to guide you and to give you the knowledge based on it, then it's easy.
It just snuck in yesterday morning.
Yeah. I've been gluten-free for almost 10 years now.
Yeah.
And we went out to eat for breakfast yesterday, and there was this granola that I've been eyeing for a very long time at a frequent restaurant that we go to. So I said, let's buy it. Let's try it. The girls eat granola. I eat granola. So we bought it, and I opened it up, went to take a bite of it, and I was like, I don't even know what told me to look at the ingredients.
Well, you took a bite, you already gave Stella a bite,
yeah.
And then you're like, let me look at the ingredients.
Right, which I should know better, and I should do very first. but sure enough, had wheat germ in it. And I was like, why would they make granola with wheat germ? Majority of granolas are gluten-free. Well, I shouldn't say that. Oh, most of them. So anyways, it sneaks in.
Yep.
Got us.
Good?
Yeah, all good. Happy Monday, everybody.
Make sure you like and subscribe. Share this episode with somebody that you know is looking for the easy button and say, you can do that. You're more than capable of going to the get quick fix clinic and get your injection of semaglutide, Ozempic, and shed the pounds. You can do all that. Nobody on this earth knows what the side effects are going to be, what the long-term side effects. Nobody has any idea what's going to happen. And here's the best part of it. Their answer is, how long do I have to take this for? Once I lose the weight, how long do I have to keep taking it?
Right. Well, with no lifestyle change forever. But it's
she said forever.
Well, forever with no lifestyle change. One thing I will say, there are some side effects we already do know regarding, GI issues with Ozempic, and that's been, most people know about that. A lot of people don't know that it depletes B12 vitamins. And I just had a client that started with us last week. She's feeling awful. Tons and tons of different symptoms, inflammatory symptoms, autoimmune symptoms. Sleep is absolutely awful. Energy is in the hole. Told me she went to a walk-in clinic and took semaglutide a couple months ago for a 2-month period. And the whole time I'm like, your B12 level has to be in the hole. Like between the GI issues and taking Ozempic, sure enough, her B12 was in the 100s. Should be in the 700 to 800 level. And the risk to that is when you have a low B12 level, it causes nerve damage. It causes brain damage. Obviously, the energy levels are low. But nobody told her when she was getting semaglutide injections at this walk-in clinic that she should be taking B12 with it. And so it's just things like this that you're not getting the full recommendation. You're not getting the full knowledge base when you're just walking into these clinics, getting a shot, paying your bill, and walking out and having no medical guidance or knowledge base. It's dangerous.
Yeah, I don't need the guidance though. My pants are feeling better, fitting better. I'm feeling better.
And your brain is rotting. Like seriously, B12 is one of the most important vitamins for the brain, for brain and nerve function. So you're going to end up with neuropathy. You're going to end up with dementia, and your energy's in the hole. But yet your pants fit, so who cares?
Yeah, it's all about the vanity. It
makes me so sad. Anyway, all right, we were wrapping it up and I just went on a rant. So rant can be over now. We'll rant again another day.
Like and subscribe. Share this episode with somebody that you know is taking the easy button, somebody that is living off Ozempic, somebody that is living off of injections in their knee or their shoulder or their back. Yeah, I just go and get injections every 3 months. It's just a regular thing. That's normal. That is not normal.
Right.
Good.
All right. See you guys next week. Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.